Hi guys, so the next paper that we're doing is paper 6. So the first one is about the respiratory system. Again, just posterior chest examination, which I have done in paper 3 and paper 9, so I'm not going to do that anymore. And then abdomen, we need to auscultate the 4 quadrants, palpate the 4 quadrants, and percuss the 4 quadrants. Okay, so auscultation of the 4 quadrants. So auscultation must be done if you're examining the abdomen before percussion and palpation, because any maneuvers done in the abdomen may alter bowel sounds. So we tend to do auscultation first before percussion and palpation, which is not normal for the other systems. So that's why the abdomen is a little bit special in this way. So for auscultation of the 4 quadrants, we basically just put our stethoscope on the 4 quadrants and listen for bowel sounds. So normally what we should hear are like gurgling or like rumbling noises due to the peristaltic movements that's happening inside the intestines and organs in the abdomen. So if they're abnormal, would be like absent bowel sounds. It's normal to hear those gurgling and rumbling and peristaltic noises. Okay, and then palpation, superficial and deep. So for superficial, we basically just ask the patient first if they feel any pain in any of the quadrants, and if they say they feel pain here, which is like the right upper quadrant, then we palpate that last. So light palpation involves just using one hand and just lightly like palpating the abdomen, and then this is the painful region, so you palpate that last. And the things that you look for are obviously pain or tenderness anywhere, any guarding, and any rigidity. So rigidity is the involuntary abdominal wall contraction, and guarding is the voluntary abdominal wall contraction. And this usually happens if there's like peritoneal inflammation or if the patient is feeling pain anywhere in the abdomen. And then after that, we move on to deep palpation. So with deep palpation, we use both hands, so one on top of each other, and can't do this. Imagine my other hand is on top of that, and just palpate a little bit more deeply. Yeah, so apply more pressure. And yeah, one hand is on top of the other. And again, same principle. We palpate the painful area last. That's it for palpation. You can also mention to the examiner the fact that, to be more specific, we can divide the abdomen into 9 different regions. So epigastric is here. So epigastric, and then the right and left hypochondriac region. And then we have the umbilical region, and then the right and the left lumbar region. And then below that, we have the suprapubic or hypogastric, and then right and left iliac region. Okay. Percussion. So we just again percuss the 4 quadrants. Normally, the percussion note should be tympanitic throughout, but if you hear dullness, this may indicate a couple of things like organomegaly or the enlargement of the organs, a cancerous mass growing inside the abdomen, or could just be the fact that the patient is constipated. So, so for instance, if you percuss the right upper quadrant and there's dullness instead of tympany, then maybe suspect hepatomegaly. If you percuss the left upper quadrant, and especially in the Trobe's space, and there is dullness, then maybe you can suspect splenomegaly. And then moving on to the cardiovascular system, we have to do precordium inspection, palpation, auscultation, which I've literally just done in paper 10, I think, today. Yeah. And then musculoskeletal, we have to assess the shoulder range of motion and maneuvers to test for the shoulder. Okay, so shoulder range of motion. So we have flexion, which is just raising the arm in front and then overhead. So this is my bad shoulder, so I'm gonna do it with my good one. Well, better one anyway. They're both not very good. So flexion, again, raising it in front of you and overhead. Okay, so that's the instruction that you give to the patient. Extension is raising it behind you. Okay, and then what's the other one? Abduction is raising it to the side and then overhead. Adduction is crossing it over to your chest, and then internal rotation is touching the opposite scapula. External rotation is basically abducting it to the side, flexing at the elbow. I can't see. So abducting it at the side, flexing at the elbow, and then pointing the forearm up like that. So that is external rotation. Okay, lost my slipper. Anyway, next is the special maneuvers. So we have here Hawkins impingement sign, drop arm sign, and empty can test. So Hawkins impingement sign, basically what you need to do is cross the arm over the chest like this, and then you just grasp the forearm close to the elbow and try internally rotate the shoulder. And if there's any pain as you internally rotate the shoulder like that, then that's a positive Hawkins impingement sign. And then the drop arm test is basically like abducting the arm to the side and then slowly lowering it down. And positive drop arm test would mean that the patient would feel pain as the patient slowly drops the arm down. Empty hand test involves having the patient like extend their arm in front of them and then tell them to, like, imagine they're pouring a can to empty a can. So they internally rotate, so they internally rotate their shoulders like so, and the doctor would apply a downward resistance and the patient has to fight this downward resistance. And pain, again, is the positive test for the empty can test, suggesting rotator cuff problems, which I do have, so I can't do it in the other arm. There are also a couple more if you want to be, I don't know, if you want to get bonus brownie points. So the not the drop arm test, the painful arc test. So the painful arc test involves fully abducting the arm from 0 degrees to 180 degrees. And if there's pain between like 60 to 120 degrees, then that's again a positive sign for some rotator cuff problems. There's also the near impingement sign. So that just involves the doctor going behind the patient and like pushing the scapula forwards and then like passively raising the patient's arm overhead. And again, pain suggests some rotator cuff problems. And then the last one is, I don't know if it has a name, but you just basically flex your elbow and then you point your thumbs up and then you basically try resist the doctor's force as he or she applies resistance on the lateral side. So the doctor is pushing in and you're trying to push it out. So that's it for paper 6.